Hey, it's Chris Beyer.
Chris Bowling. What's up, buddy?
CB, how are you, sir?
I'm well, and you?
Good, good. Wanted to talk today about what we're seeing in terms of improvement for a lot of our clients adding direct provider contracts for their health plans. It's certainly saving the company money, but how does that benefit the member, especially as we see people struggling with healthcare costs today?
I go back to the first time we did this, right? When we established a network here in the Quad Cities, we had an employee that was going to have a hip replacement,
Yep,
just going through the health system, came back at $62,000. The guy was able to use his same surgeon, just did it at an ASC,
yep.
and we dropped it to 30, something like that.
Yeah, under 30,
Yeah,
yeah,
yeah, under 30. So that's a perfect example. And the way you and I design these direct contracts, assuming that they're not in an HSA,
right.
we waive deductible co-pays. That's pre and post-op,
Yeah,
PT, everything. And, this employer saved a truckload of money. The guy was happier than heck.
yep.
Um,
Well, he had about a $6,000 max out of pocket on the plan, and he got it completely waived to have the procedure probably at a better location for outcomes and the
heck yeah.
employer saved. So I love that concept where we're starting to
Right.
see wins for the families that don't have to pay deductible and co-insurance to have things they're likely delaying. We've seen a lot of that happen.
Yeah, and let's take that into, something like colonoscopies.
Yeah,
You know, I'm I got mine. He said, come back in 10 years. I don't want to wait 10 years,
yeah,
So now my health plan's not going to pay for it if I want to do something sooner.
correct.
It's going to be diagnostic. Okay, what if I have colon cancer in the next 7 more years,
Yeah,
Why not go in, have a
yeah,
colonoscopy at a fraction of the price of what, again, if you go through a health system.
yeah,
And guess what? I could save my employer hundreds of thousands of dollars if I can catch something early. So,
yeah,
we do that with mammograms, all of those
yeah.
things. So,
I think it's just bringing clarity for the member too, because exactly right. I think something's going on, and all of a sudden, preventative becomes diagnostic, and they have that surprise bill.
right,
If you start down that path, your employer's saving, but
right.
you're not having to spend money. And I think even some of our more advanced care. So this is fairly local for orthopedics, imaging, physical therapy. But if somebody's going through major cancer, they need to go through a major heart procedure helping that employee and their family get to the location, give them a travel stipend to pay for food and pay for lodging. I mean, you just think through what that means for a family that, most people don't have 500 bucks set aside, let alone to pay a
Yeah,
$5,000 deductible. And they're probably going to get better care through the whole process
100%.
and better experience.
Yeah,
And
we had a we had an individual went to a little bitty rural hospital. No, there's nothing wrong with that, by the way. We do support our rural hospitals, but had a really weird, funky thing going on. They spent 110 grand, got
yep,
absolutely, no diagnosis because it was rare. They went up to Mayo for the same 120 grand. They figured out what it was, got it treated, and now he's back on his feet. So this goes back to, like you said, if it's something rare that you got to get to a centers of excellence, somebody that is so good at this stuff,
yes,
why not pay for it,
yeah,
And like you said,
yeah,
give him the stipend, give him the housing allowance, because he was up there for weeks, but
yeah.
they were able to finally figure out what the heck was wrong with this guy.
Yeah. I think that's just it's become the new solution. And we've been talking about this for 5+ years, but how many of our clients now can say, if you make the right choice for care, you don't pay. If you make the right choice on your pharmacy, you don't pay. I mean, think about that not only impacting that family's household, but
Right,
then also think about that from a recruiting and retention standpoint. You come to work for us, we offer you access to no cost healthcare. You may still pay some premium,
right.
but it's those large out of pockets that we're waiving and they're making the difference.
I
So
love it.
it's exciting to see. I know we're adding more and more to that program in terms of access and locations, but again, it's taking care of the family, and that's really what the intended benefit should be.
Absolutely. Love it. Good stuff.
Excellent. Good to see you, CB.
All right, we'll see you, buddy. Take
All right.
care. Yep. All right,
Bye-bye.
bye-bye.